Hey everyone, doing a quick video on how to administer respiratory medications. This is only in the case of a surge. What the expectation is, there's a possibility that all our respiratory techs are going to get pulled for priorities, and we're going to have to help out by administering respiratory medications. This is not something that's going to be implemented right now, but this is something we're showing you in case it happens and we're ready for it. Okay, so the things we're going to discuss are how to administer a metered dose inhaler, a metered dose inhaler with a spacer, a capsule inhaler, and of course a nebulizer. So we're going to start with the inhaler, and then I will also tie in there how is it that we're going to document that in Cerner. So the metered dose inhaler, I'm sure you're familiar with what it looks like. Now to administer this medication, the patient is able to give it to themselves. You just need to observe. And if they're going to use a metered dose inhaler alone, then they will have to use the closed mouth technique, which is their lips are wrapped right around that mouthpiece. Ask them to keep their tongue out of the way. That way when they inhale it, the medication goes all the way into their lungs. Now if it's brand new, you want to make sure you pump it about 5 times or until you see a mist. And you want to shake it as well. Now of course, before you administer any medication, you're going to have your baseline data. You're going to have your vital signs, your lung sounds, etc., etc. You give your medications, and you're always going to have a post-assessment as well. And I'll get to that in the Cerner documentation. So for the metered dose inhaler, have the patient expel as much as they can, expel air as much as they can, and then as their mouth is wrapped around the mouthpiece, they're inhaling and pumping at the same time. Now for those of you that are working on COVID floors, on the COVID floors it is recommended that our PUIs and COVID patients use a spacer. And the spacer will have a piece that the MDI goes into, like so. And then you have the mouthpiece for the patient to inhale from. If they are unable to use the closed mouth technique, we have a mask that we can attach that comes with the spacer, so they could get rid of it. So the difference between administering with a spacer and versus the MDI by itself is you can go ahead and pump the medication into the chamber, then the patient could go ahead and exhale and inhale through the mask. Okay, sorry, that's so close. Through the mask or through the mouthpiece. Now, when they do inhale, whether it's the MDI by itself or the spacer or even the capsule inhaler, they have to take a deep breath with the medication, and then they have to try to hold their breath for at least 10 seconds. Okay? Now, when it comes to documentation, in Cerner, you're going to have to add the Cerner, the respiratory navigation band. So the navigation band in Cerner, you go to View, then to Layout, and then to Navigator bands. When you select that, the Navigator menu opens up. You select respiratory therapy, bring it into your current document types, and you hit OK. When you hit OK, you need to log out, log back in, and when you look in your interactive view, you will see the respiratory therapy band on the bottom. When documenting, when you select the band, this is what it will appear. This is what it will look like. All right, very important that you document a pre and a post assessment. So after you give the medication, there are at least 7 different points that you're going to document in the respiratory therapy band. Starting with number 1, the starting or ending of the treatment. Number 2, the patient effort in treatment and participation. Number 3, select treatment modality. Number 4, the route of the delivery. Number 5, the monitored heart rate and respiratory rate. And please note that if the heart rate exceeds more than 20 BPMs per minute, then that needs to be addressed. And number 6, the response to treatment and your reassessment. So this is what it looks like if your patient is on O2 or having their O2 sat monitored, to be sure to include that in your documentation. And here's an example of it. Here's your SpO2 and your O2 sat levels. Okay, one of the documents that we have provided to you is a Did You Know on metered dose inhalers, and it comes with the instructions on how to administer the metered dose inhaler and what are some examples. All right, and we talked about spacers are preferred for your COVID and your PUI patients, and here's how is it when you use a spacer. And once you work down to the bottom, you'll see how it is used with a mask, and finally the capsule inhaler. Now the capsule inhaler is very similar to your metered dose inhaler. Now the capsule inhaler this is what it looks like. Now to use this capsule inhaler, you're going to open it. Of course, you're going to be wearing your gloves. You're going to open the chamber, grab the capsule, add the capsule to the chamber, and the chamber is right there. It's going to stick out a little bit, as you see in the pictures. You're going to close the chamber, and you're going to pierce the capsule 1 time. This is what this button on the side is for. It's for piercing the capsule. is for piercing the capsule. Okay, have the patient inhale it the same way he or she would use a metered dose inhaler, and of course we're going to document our pre and post assessments. For your nebulizer treatments, we also have a resource, a Did you know for your nebulizer treatments. Now, the nebulizer treatments come in a package like this. And in this package, you'll have the closed mouth technique with your vent. If the patient is unable to use this mouthpiece, let me show you a better example. By the way, this is the way it goes together. You have your chamber, your T, mouthpiece, vent. Got it? Tubing goes on the bottom. If the patient is unable to tolerate the mouthpiece, then we can get a face mask and add the face mask to it. And we can use that as well. Now, they're using the face mask, we have to make sure to ask the patient to breathe through their mouth and breathe regularly with an occasional deep breath. So for the nebulizer treatments, you will also have a document that will help you out in the case that you need to administer nebulizer treatments. Now, as I explained before, the albuterol can come in a concentrated vial, which you would then have to add the 2.5 mLs of normal saline, which is the pink ampules. So it has to be the pink vials. So this is also a document that will be available to you. And also we'll be providing a nebulizer cheat sheet for you in case you need it. Okay? So some important points for you to remember is always have your baseline data, administer your medication, and then your post-assessment. Make sure you clean up after, depending on what the device is, and have the patient hold their breath for at least 10 seconds when they're using the metered dose inhaler. If you have any questions, please see your clinical educator, and they could help you out with whatever you need. Take care.